Hi everyone, I'm Onymarama, a YouTuber based in Abuja. If you're seeing my face for the first time, you're welcome to my channel. For my returning subscribers, thank you for always returning to watch my videos. Okay, today's the beginning of a new vlog. In my office, we are having this health sensitization organized by the HR department and the compliance department of my organization. Okay, and I think people training us on that or sensitizing us on that is Nisa Premier Hospital in Abuja. I'll carry you guys along with me. We'll be talking about cervical cancer, prostate cancer, and breast cancer today. It's going to be an educative one and an interesting training actually. You guys will learn a lot from me. So let's go there. Follow me. Let's go to my conference room.
So, on a serious note, I've had
you even have breasts, so you can even use
opportunity to have some training on aspects like this, and we have some colleagues that we have discussed issues like this in respect to breast cancer precisely. Because of recent in my area, we've lost like 5 or 6 people to breast cancer. As I'm even talking to you, 5 days ago, a very close by neighbor lost his wife to breast cancer. It's very close.
The aim of this lecture is to educate us more and let us know more about these things, because as distant or far away as they are close to us, and as he said, his neighbor's wife died of cancer recently, and it's a very, very painful experience to have that. And I have had my own painful experience as well, where my neighbor, a very close friend, we even have a fellowship in her house, has been nursing breast cancer without even opening up to me that I'm a doctor. So when it happens to you, it hits you hard and all, to the point that I got to the point where her breast fell off on its own.
Jesus.
That was how bad her case was. And a few days later, she died. It was too painful to hear. And, you know, this is why I take this particular topic personal. I've had my experience, others have had their experience. We think cancer is far away, but it's as common as you can think. Very young ladies, young men coming up with cancers of different types. But we cannot discuss everything in such a short time, so we'll try to pick key topics and just have an overview about it. And with time, you get to know more. And that's where Mr. Premier comes in. We want to help to bridge this gap and also offer services to you all to be able to, you know, live healthy and also your family. And I intentionally pick a man to discuss about the breast examination and a female to talk about the prostate. Because when you talk about breast cancer, most people just it's about the women. And when you talk about prostate cancer, we just it's about the men. But it's about all of us. Because if it happens to your wife, it happens to your husband, it happens to you and the entire family. And for breast cancer, it's not only a disease of females. Men also have breast cancer. It's just that it's very rare. And when it occurs in men, it's usually more fatal than women. But it's very rare, especially in the blacks. It's more common in whites. So we'll be starting quickly with this. What is the purpose of this discussion? The purpose is not to move high-falutin stuff for you, because you are not going to write an exam. It's just to give you basic key information about this, where you'll be knowledgeable enough to educate your family, educate your community, and also have your own information that can help you seek help early enough.
Sorry, in addition to this, I'm sorry to say, I lost my mom when I was 8 years to breast cancer.
So sad. So I can see.
So
Sorry about this. And to discuss generally the health benefits and highlight key points about it. So what is cancer in general? Normally, the body has a mechanism of growth where if you have dead tissue, you have an injury, you have this, the body grows back and replaces the lost one. But cancer happens when the signal that the body sends to the growing structure to stop when it's supposed to stop is lost. And it becomes an overgrowth over the usual boundary, and it shoots and spreads round. It becomes cancer. And when anything doesn't have control, it becomes a problem. No matter how important it is, food is healthy, right? When you eat without control, it becomes a problem. No matter what it is, there should be control, and that's what cancer is. This is the normal cell, and that's the cancerous cell. Okay, so we'll be talking briefly, we'll be starting with the breast cancer. So this is the anatomy of the female breast and the different structures of the breast. As we already know, the nipple, the area around the nipple is the areola, the breast itself, the structure, the tissues of the breast, we have ducts, we have lobus and all. So we'll be talking briefly about the burden of breast cancer. It is number 1 worldwide. Number 1 cause of death in women especially. But in gynecological cause, that's restricting it to the female reproductive system, the cervical cancer is one of the leading causes of death. But generally, in all, from head to toe, breast cancer tops the list. And it is painful because the breast is visible and it's easy to pick issues when it starts. So that's the aim of this health talk, so that we don't die from what we can prevent. It is important to know that breast cervical cancer, they are preventable if picked early, and that's why we're here to educate you. So it is, the burden is increasing, particularly in developing countries. The risk is higher in the whites, but because they pick it early, they seek help early, they recover better than us. Here, because of illiteracy, lack of accessibility to basic healthcare, cost and all, when they come to you, they come in advanced stages, and also spiritual beliefs in some areas contribute. Here we keep praying and praying, and I'm not saying it's bad, but we should balance it with wisdom. You understand? That was what happened to my friend. She kept praying about it, but she didn't voice it out. And unfortunately, I don't know how it got to the stage where she lost her life. But we should balance our faith with also seeking help. And that's where it comes. So thousands of women still die from it. And those that seek help fast have very good prognosis as they recover well. So cancer is the growth of abnormal cells, as I showed you earlier. And if this damage is not controlled, it now leads to cancer depending on the region of the body. If it's the breast, it's breast cancer. If it's the cervix, it's cervical cancer. And if it's the prostate, it's prostatic cancer. So what is the cause? Almost all things, the exact cause is unknown. But there are different mechanisms you can put into place that can give you a clue. And also there are risk factors. We have the modifiable and the non-modifiable risk factors. So one, the most likely cause is related to genetic material. And that's why family history of cancer is a very strong contributory factor to development of cancer. If you've had cancer in your family, you are classified as high risk category or group, because the chances of you of the person developing cancer later on in life is far higher than a person that has no family history of cancer. So it plays a major role. And usually when you have anything that interferes with the DNA is like one of the molecular structures that helps to form cells and all. Anything that interferes with the normal function, disrupts it, can lead to uncontrolled growth, which can lead to cancer. So there are some unmodifiable factors like gender. You cannot change your gender. If you want, you can say transgender, you can say whatever. The gender is still there. You just increase your risk of developing some conditions by even denying your gender. So those are unmodifiable. It is what you can't change. Your race, you can't change. If you are black, you are black. If you are white, you are white. No matter what you do, you can't change it. So those are unmodifiable risk factors. It's more, as I said, it's commoner in the whites, but the disease burden is more in the blacks because of late presentation and also advanced disease at presentation. So also aging, you can't change that. You must grow old. And I believe it's our desire to live a long and fulfilled life, but the prayer is to live a healthy life as well. So the older you get, the more your risk of developing different conditions, including cancer. So those are some of the risk factors. So now obesity is also a major contributory factor. Yeah, these are now modifiable risk factors because they are things you have control over, and by controlling it, you can now increase your chances of, reduce your chances of developing things like this cancer. So lack of exercise, smoking, unhealthy diet, dense breast tissues, those are modifiable risk factors that can also lead to cancer development. But the exact mechanism is not known, but from research it's been shown that people that have this condition and those the cohort, that's the control group without this, over years, those with such conditions tend to develop the condition faster than those without it. So this was how they came about this as contributory risk factors. So now, previous history of breast cancer is also a risk factor, because the fact you have cancer on one breast doesn't mean you have cancer on the other breast. So if you feel, if that's why when I come to the things we can do to prevent it, if you see it, it helps. So if you've had a cancer in one breast and you were treated, the risk of developing cancer in the other breast has increased compared to someone that doesn't have at all.
Excuse me, can you go back to the last slide? No.
Okay, sorry.
Dense breast tissue, what does that mean?
Okay, dense breast tissue. Okay, so this is for women with very large breasts.
Okay.
Yes, because one of the reasons why they are more at risk, one for such women, even when they try to check, because of the volume of the breast, they can't even pick a tiny lump when it starts and all. And even the one of the major screening tests, which is the mammography, may not pick a tiny mass as easily as it can pick for a woman with a smaller size breast and all. That's why they are also among the at-risk group.
Okay.
You understand now? That's all right. Thank you. Okay, so also as I showed you the anatomy of the breast from the beginning because it is important, and breast cancer can develop even from just a lobe, because there are like 15 to 20 lobes in the breast. So when you pick it early and we do what we call a breast conservative surgery, we're able to remove just that segment. It's not a must that if there's breast cancer, it has to be the entire breast that will be removed. That's what we call a mastectomy. If it's picked up on time, just that portion can be removed. And depending on because when you remove it, you remove the cancerous part with some part of the healthy cells and take it for histology. As long as the healthy part doesn't show signs of cancer, you can continue what we call either chemotherapy or, depending on the stage, chemoradiotherapy. You understand? For such women, it's good news because they picked it up early. But the truth is, they are more at risk of developing breast cancer from the remaining parts of the breast or the other breast. That's why we say for women with previous history, they have more risk factor. Then also exposure to radiation. Radiation disrupts the genetic components of the cells, and it can now lead to suppression of what we call the tumor suppressor genes and lead to overgrowth of cells, which can cause cancer. And also, I mentioned the other ones on the list here. So there are some other factors like
talk about that radiation.
Yeah, that was what I just explained. Radiation is like X-rays, frequent X-rays. There are different things that may make you to be exposed to radiation, probably tests and all. And that's why before we order tests, we want to know how many times you've had like X-rays, CT scans. Those are tests you can be exposed to radiations. And there are some other radiations that maybe due to your profession, like those working in such areas. And that's why there's this heavy jackets they wear. If you lift it, it is very heavy to protect them, because constant exposure to those radiations will interfere with those genetic components I mentioned earlier and lead to overgrowth of the cancer cells. Okay.
As if you already have it or what?
No, this one now, you don't have it, but being exposed to the radiation can
alter your DNA.
Can generate the risk for you to have it.
Please, I have a question. You know that stuff they use in putting gel polish after painting your nails?
Yeah, I used to get
Is it a radiation? Is it also?
Those are not the radiation we're talking about. Because for you to really be exposed to radiation to cause this, it's high dose, and these ones this one, those are not the ones who are here, not those.
Okay.
Okay. So at the end of the presentation, we can just note our questions down. There will be time for questions to answer all your questions.
Okay.
So early onset of menses and late menopause predisposes to a lot of such conditions: endometrial, breast cancer, cervical cancer, because you are exposed to the female hormone estrogen for a longer period of time. And also when you are not pregnant as well, the time during pregnancy, that period is like a protective period for a lot of malignancies. You understand? And also breastfeeding is also protective. So early onset of menopause, menses and late menopause, so they are all risk factors. and hormone replacement therapy for women that have gone into menopause for different reasons. You may be required to prescribe hormonal therapy for them. Probably they are having excessive menopausal symptoms like exaggerated sweating, irritability, restlessness, so many things that may occur from the withdrawal of the female hormone. For such women, you may prescribe what we call hormone replacement therapy, and if it's not well balanced, it can also be a risk factor for breast cancer. So these are protective factors. As I mentioned earlier, pregnancy, breastfeeding, they are protective factors for breast cancer. So prevention,
Sorry, ma, please go back to the women who haven't had a full-term pregnancy or have their first child after age 30 have the high risk of breast cancer. Age 30.
Yeah,
Okay.
so as I mentioned earlier, if you are exposed to the female hormones for a longer period of time, you have more risks. These are risk factors, but they are not as strong as the genetic, as I mentioned earlier. These are just contributory factors from experience, so they are possible risk factors as well. So breastfeeding as well can lower the risk. So prevention, which is the key aim of this presentation, because it is a waste of your time and mine to come and tell you about a problem without preferring solutions for that problem, is the key reason we're here, and the aim of it is to be able to detect it on time, even before it becomes a problem. And this is where we have to take it personal and also educate those around us. There's no sure way to prevent it, we must establish that, but there are things all women and men as well can do to also increase their ability to detect it early and also prevent the complications that may arise from it. And this brings us to what we call the breast cancer screening. Okay, screening is the general things you do to pick up something before it becomes a problem. And for breast cancer, we have some basic things we can do, which is the first thing we discussed, the breast self-examination. And also we have the mammography, which is more specific. And we also have other things we can do like breast ultrasound scan, magnetic resonance imaging, which we refer to as MRI, can also help in picking it. So amongst this, where you come in is breast self-examination. It is cheap, it is easy to do, and it's something you can do in the comfort of your home. Okay, so he discussed it earlier, but now I'll be teaching us how to do it the right way, so that we can do it monthly, especially for the ladies, the husbands. You can do it for your wives, and also for yourself. You can just feel it here and there to be sure that you are also clear. So this breast self-examination can be done by yourself or by the healthcare professionals. For yourself, you can do it monthly, but for the healthcare professionals, you can do it yearly for you, in addition to the one you've been doing monthly. Okay, how is it done? So for the breast self-examination, it is better to do it in front of a mirror, naked, that's at least from your waist to your top, fully, without any bra or clothing. You stand with your hands by the side, looking into the mirror. You are looking at the shape of the breast, the position of the nipple, the skin, the color, any discharge coming out. You look at it when the hands are down, when the breast is free. Compare both breasts. Usually for most people, one may be a little bigger than the other, or the nipple may be slightly different, but it shouldn't be prominent. After that, you want to put your hands on your hips, tense it, and look into the mirror. It stretches the muscles under and makes it more prominent. At this stage, you also want to look for the same things, the size, the shape, the skin, and all. When you are done with that, you now raise your hands up above your head and still do the same thing. Examine it all around. When you are done with all that, take note of any changes and all. For you, you can now lie down on a flat surface, your bed or something, and your right hand examines the left breast, your left hand examines the right breast. And for you to ensure you examine the entire portion of the breast without missing any part, you want to go, there are different ways to go. As I noted there, you can go circularly, you can go horizontally, you can go vertically, but I usually advise you do it circularly. That way you'll be able to go through the different quadrants of the breast without moving and missing out anything. With your hands together, making a fist, you use the palm of your hands, palpate, that's like massaging kind of way. Each portion you are feeling, as you are feeling for any mass, any lump, any pain, and you are going circularly round the entire breast. Then you come and place the palm on the nipple, where you massage as well to feel if there is any hardness, swelling or that. And don't forget, a portion of the breast goes into the armpit, which we call the axillary tail. So you also use your hand. You know, I mentioned left, right for left, so you do it that way. This now goes into the armpit and massage for the axillary tail to feel anything. When you are done, you want to do the same on the opposite breast. If there is nothing, fine. You now want to express for discharge. So you now keep pressing till the nipple. You do the opposite side to see if there's any discharge. Sometimes it may just be a cleared fluid, it may be a liquid discharge, it may be bloody. Whatever you see, report to the hospital so we can reassure you and let you know if it is okay or if it's something to investigate further. Are we clear with this? Because this is important, right?
If you are not clear, ask question. I have question. So
So
that I'll not forget.
Write it down.
it's all right. So at least I hope we are together at this stage to an extent. It's all right. So that's for breast self-examination. So it's recommended for women above 20. It should usually be done 7 to 10 days after your menses and report to the doctor if you find any abnormality. So next we'll be discussing is the breast mammography. This is very important as it helps in early detection of cancer 2 to 3 years before it is even felt visibly with the finger. So this picks it even before you can feel it. And as we say, the burden of breast is in older age group. And mammography is like an X-ray. So usually doing it is recommended from 40 years. When most women have finished their reproductive career, you can now do it from 40. It is low dose radiation and it's something that is safe to do once a year for high risk patients and every 2 years for low risk patients from 40 to 49 years of age. And from 50 years above, you can now do it annually because the risk, as I said, increases with age. So it is recommended that at 40 years, if you can at least do a mammography as baseline. And this is where Nisa Premier Hospital comes to you as one of the centers you can trust for a very reliable and very good film for your mammography where you can trust the results. And as Mommy asked earlier, for dense breast tissue, this may not be okay to do only a mammography because of the density of the breast. There are some tiny masses that may not be picked. So in addition to a mammography, we want to also offer a breast scan where we also scan around to be able to add both investigations together to pick up any issues that may be present. Okay, so now that's for breast cancer. At the end, I will just summarize the treatment of all of them together because they have the same principle, and I said this is not a professional lecturer. I'll be breaking down stuff for you, just the basics I'm bringing to you. Okay, so quickly we'll be talking about cervical cancer and we'll wrap it up with prostate cancer. So I'll be a little faster so we can meet up with time. But if I'm too fast, please, you are in charge, calm me down. Okay, so cervical cancer. So the cervix is the lower portion of the female reproductive system, which is the uterus, generally referred to as the womb. That's the uterus. And the cervix is just like the mouth of the womb. That's the opening of the uterus. From the uterus to the vagina, you meet the cervix. And because of the location of the cervix, there are lots of changes that can happen on the cervix over time that can lead to malignancy, and that's why it's one of the common causes of cancers in women. Because of the contact, the vagina is an acidic environment. Acidic because it is open and it is exposed to several organisms. So the acidity of the vagina helps to kill some of them and prevent them from causing issues to you. But the cervix is like gentle. It's a gland, and usually sometimes from prolonged exposure to that acidic environment, sometimes it may start having some changes on it. And if you now have if the person now has repeated risks of infection, it may now make the cervix vulnerable to some changes that may now cause cervical cancer. But the good news, it is one of the most preventable causes of cancer because there's a very large latency period of about 15 to 20 years from the pre-cancer condition to the cancer condition. And that's why it's one of the major things you should screen for, because you have like almost 15 years before, if there is a change on the cervix, it can lead to cancer. So if you screen regularly, almost always you'll be able to pick it up before it becomes cancer. And that's where NISA comes in. We can offer you all the screening services for you to be able to pick it up early. So now we'll discuss them as we go about. It is the commonest gynecology cancer death, as I mentioned, and one of the easiest to manage as well through screening and early vaccination, which the government is also helping in that regards right now. So this is the uterus, that's the womb, as we can see. This entire portion is the womb. Okay, it's not reflecting on the screen. Okay, I'll just reflect. This is the womb. So this is the cervix, the mouth of the womb, as I mentioned, and this tubular structure is the vagina, the canal. Okay, and these are the tubes, the fallopian tubes, and the ovary hanging at the end of the tubes. So this is the magnified view of the cervix. So this other outer portion is the normal looking cervix, and this portion here is the part of the cervix that is already showing signs of malignant change, that's cancer change. Unfortunately, it's a sad statement, but it is true. One woman dies of cervical cancer every 2 minutes, and each one is a tragedy we can prevent. While we are here, several women at different in different parts of the world, different times, they are already dead from cervical cancer, especially in developing countries. And I believe none of us here or our loved ones or relatives will be part of that statistics, because with this information we'll be able to take care of ourselves. Okay, so that's the aim of this. So the causes, the major cause of cervical cancer is from infection with a virus we call the human papilloma virus, and this virus is usually sexually transmitted. And there are several types of the virus, but the high risk one that is usually notorious in causing cervical cancer is the type 16 and 18. For the low risk one, the type 6 and 11 can cause these genital warts that some people have from time to time. So risk factors for cervical cancer: early sexual exposure, multiple sexual partners. You may not have that, you may be faithful, but if you are in a relationship with someone with multiple sexual partners, you're also at risk. So it goes with, because the men don't have cervix, but they are the carriers, reservoirs of the virus, and they will infect you.
Maligima, Lambo, Lambo, Lambo.
Yeah, so there are other things that can also increase the risk of developing cervical cancer, repeated sexually transmitted diseases, or if the person have infection with other sexually transmitted infections like gonorrhea, syphilis, herpes, chlamydia, they can increase the susceptibility of you developing cervical cancer if you are exposed to the human papilloma virus. And also when there are immunosuppressive conditions, that's things that reduce your immunity to fight infection, like HIV infection is one of the commonest causes of seeing cervical cancer in very young ladies because of the low immunity in them. And also if the person is on prolonged use of steroid for different conditions, it could be autoimmune conditions, it could be other things, but if it's used for a prolonged period of time, it can also suppress the immune system and lead to them having these risks. And also cancer treatments for chemotherapy, organ transplant, and some of these things can also be risk factors. And that's why when we are doing this, we try to give drugs as well to boost the immune system to also help reduce these risks from happening. Then cigarette smoking, high priority for women that have delivered so many, greater than 7, the repeated delivery has also can also contribute to cervical changes and also increase the risk. And also prolonged use of oral contraceptive pills can also increase the risk of developing cervical cancer. So the key strategy by the government in reducing this burden of cervical cancer is referred to as the Vision 2030. It keeps changing. It was 2020, now it's 2030, but we'll keep pushing till we get there. And the aim is 90-70-90 rule. What is the 90-70-90 rule? Yeah, protecting children, that has vaccination. 90% of children should be vaccinated. Then the 70 is to offer screening services to at least 70%, which we offer both the vaccination screening as NISA Premier is available for you, and treatment on time to treat the pre-malignant. As I mentioned, it has a wide latency period of 15 to 20 years. So if you discover, you treat early, to prevent the cancer and also treat the cancer itself. And for the vaccination, it is targeted at young ladies even before their first sexual exposure. And that's why the government is also advocating free vaccines now to be able to meet up a wider range of girls and boys also get the vaccine. As I said, they may not have the disease, but they can increase the risk of infection. So before the vaccine is recommended to have 3 doses, 0 months, that's at contact, 1 month after, and 6 months after. But because of the cost and follow-up, it is not advocated that even a single dose of the vaccine is still okay. So as much as possible, between the ages of 9 to 14 years of age, if you have both male and female children, they should try to get the vaccines early enough, and also they can get up to 29. But for older age group, before getting the vaccine, you may need to do tests to rule out the presence of the virus, the human papilloma virus, so that because if you're already exposed to the virus, the vaccine may not be so effective again to you. So there are the vaccines. There are 2 major ones. We have the Cervical and the Gardasil that attacks the major strains. As I told you, type 1611, that's the one covered by the Cervical, and that's the common one available. And the Gardasil has for the 1611, 6, 11, 16, and 18 that covers for both genital warts and also cervical cancer. And we also have the Gardasil 9, which is not common in our environment, that also covers other strains outside these 4. We have 31, 33, we have 45, 51, 58 strains it also covers. Okay, so the summary of prevention of cervical cancer, primary education, which is what I'm doing right now. And after the sexual abstinence, if possible. If it's not possible, be faithful to a faithful partner, and also vaccination to the younger ones. And the secondary prevention is the early screening, and there are different kinds of screening methods. And pap smear, I'm sure we've heard about it, is one of the major screening methods which we can offer you at NISA. We also have the VIA, the VILI. The VIA is the visual inspection under acetic acid. This is like the one used in low resource setting, where either you are doing a community outreach or where you can meet so many people at once. It's not as specific as pap smear, but at least it's able to pick up majority of pre-malignant, that's pre-cancer conditions. At least it's better than nothing. So it's still being used in developing countries, and that's what most outreach is used presently. And also we have the HPV. As I told you, the major virus, we can do the DNA to check if it is already present, and if it's not present, you can now get the vaccine and you can monitor it. For the pap smear, it should be done every 3 years, and for the HPV DNA combined with pap smear, if you do that, you can do it every 5 years as long as it's normal. You keep screening till you are 65. After 65, the risk drops, because most time at that age, many people are not really sexually exploitative at that point, so the risk drops and you don't need to continue screening at that stage. So for colposcopy now, for high-risk cases where you have detected something either from the pap smear, the HPV, and the rest, colposcopy is like a camera that now helps to zoom and look at the cervix and be able to biopsy suspicious areas for confirmation of the diagnosis. All this, they are all available at NISA Premier. So tertiary prevention focuses on the treatment now, which could be dependent on the stage of the disease, where we can do for the pre-malignant condition, their ablative, that's destructive procedures, and their excisional, where you can cut off the suspicious region, take for histology. So this app offers you free and innovative information, helps you to also set reminders on when to go for your screening and also follow-ups, and gives you key information about breast cervical cancer. And you can just easily download from your app or your Play Store and go through and maneuver your way through it. So lastly, we'll be talking about the prostate cancer, which will be what will be running on. This is not going to take us so long. And the prostate is seen in only men. Women don't have prostate, just as men don't have cervix, right? Yeah. So this prostate is not visible to the eyes. It is under the bladder. It can be felt through the rectum. Okay, I'm sure some men here may have had it examined through a digital rectal examination, where the doctor is able to put the one finger into your rectum and feel and palpate it. Just how we examine the breast for the women. Men above 40 should have a digital rectal examination done from time to time, at least once or twice, once or every 2 years, at least get it felt and examined. And if there are cancerous changes, there are things we feel and palpate on the prostate that we can use to advise you accordingly. So as I mentioned, it is a tiny structure found just in front of the rectum and below the bladder. It is about the size of a walnut and makes and contribute part of the fluid that is seen as the ejaculating men. So this is where the bladder is, and this is the prostate, this tiny structure there. And this is the number 1 cause of cancer in men, just as breast and cervix is in women. Prostatic cancer is number 1 in men. So you must take it personal. And this is like a zoomed out version of the prostate, the bladder, the rectum, and this is the prostatic gland. How common is it? It is very common, and it is the number 1 cancer in men in Nigeria as well, 11% of male, and Nigeria will contribute one of the greatest burden in the world. The mean age is about 67 to 72 years of age. Yeah. So what is the risk factor? Similar to others, old age is the older you get, a strong non-modifiable risk factor. Your race is a risk factor. Family history of prostate cancer is a risk. Genes and other things like the diet, obesity, and other sexually transmitted infections. But these ones, they are still under further research. So this is it. African men, the 1 in 5 men are being diagnosed of prostate cancer. That's for those that go on time to check, and that's for African as compared to the general population. And 1 in 20, yes, that's how common it is in older age of age.
1, 2, 3, 4, 5, 6.
So who will benefit from this?
1 in 5.
The good thing is there is a blood test that is non-invasive that can help detect the risk of having a prostatic cancer early enough. It's called a prostate specific antigen. Any man here that's done it before? Okay, so that's why we're here to educate it. We also offer it at Mr. Premier. It's just to take a little of your blood and do the test. For cases of cancer, there is markedly elevation of the prostate specific antigen, and it can give you a clue that yes, there's a problem somewhere where you can now do further investigations to check. The good news is not so expensive, and also it is easily gotten. You can just get the sample from just a blood test. And there are some symptoms that may also increase your suspicion of a prostatic cancer, where you have it's mostly urinary symptoms because of the location of the prostate just under the bladder. As the gland gets diseased, it can increase in size, and in the process of increasing, it constricts the passage of urine, which is called the urethra. The person starts having symptoms. It could be irritative or obstructive. The irritative one has to do with frequency of urination, urgency. You cannot wait to get to the toilet before you even get somewhere else. Already start peeing on themselves. Increased frequency even at night, and also pain on urinating. The obstructive one could be difficulty in urinating. You've gotten to the toilet, before you even start, there will be you pause, not deliberately, but before the flow of urine will come, or while urinating, there will be interruptions to the flow of urine. It's called poor stream. Or when you finish urinating, you have a sense that you have not finished voiding. It's called the sense of incomplete voiding. You still feel, or sometimes there may be retention of urine, which could be acute when it happens suddenly, or chronic when you keep urinating in bits and storing back, and all of a sudden you just notice you cannot urinate further. Those are some of the conditions that can contribute to you suspecting prostate cancer. In advanced cases, the person will start having pain in other structures, either cough when it has metastasized to the lungs, bone pain which is a common part of the body where the prostate cancer metastasizes to, which is the bone. So as I mentioned, the prostate specific antigen is one of the major screening tests. It is a protein-based substance, easy to measure, and for the digital rectal examination, it is done with the man lying on the table with the legs flexed, with a glove finger well lubricated. The anus is gently depressed to relax it, and the finger is advancing to the anus, and you massage and feel the prostate. Check the shape, the consistency. In prostate cancer is usually hard, but in the pre-malignant form, which is called the benign prostatic hyperplasia, it can be firm instead of the normal consistency. So you're able to pick it up. And the other things you can do a prostate scan, do bone scan, CT scan, a PET scan can also be done, MRI depending on the stage. Another ancillary blood examination can also be done, like the urine MCS and full blood count to monitor. So the other thing that can increase this prostate-specific antigen, we said is important, but these ones will not increase it as high as a prostate cancer will increase. So it's not in all cases that it goes up that it is a cancer. So as I mentioned, the benign form, benign meaning it is enlarged, but it is not growing out of order, so it's localized. And this is the most common in men. Most cases are not cancerous, they are benign. And in this case, you can just do a prostate surgery where you remove the prostate, called a prostatectomy. So benign prostatic hyperplasia can cause it, advanced age, increased infection, prostatitis, and also ejaculation. And that's why when you want to do the PSA, at least you should abstain for sex for at least 2 days before the test is done. If not, it can give you a falsely elevated value. So what are the advantages? I mentioned it's simple, affordable, it's just a blood test, and it can help to detect the cancer early. Most of the time, if it's elevated, it increases your risk. The cons is that it may give a false positive test for those other conditions I mentioned, so you should be able to rule it out. And it is can it be prevented? Yes, I said most of them you cannot entirely eliminate it, but there are things you can do to improve your lifestyle. Those risk factors, the modifiable ones, you can prevent them from having the risk of the disease. And the role of health education is also a key point in preventing it, which is what we are doing right now. And this helps us to educate, know about it, identify at-risk population, the symptoms to worry about, and also know about the screening tests you can do to make it available. So we've discussed the overview of the different cancers we mentioned: breast, cervical, prostate, and all the screening preventive services. We have them available to offer you at NISA Premier at a very good rate. And now for the treatment, I left it together because they have similar conditions. We have the supportive, we have the medical, we have the surgical. And for the supportive or palliative, usually those are for advanced cases where you can usually do nothing for those group of people. You just have to improve the quality of their life till whenever God calls them home. And that's the palliative care. And for the medical care, is where you have been able to pick it up early, and depending on the stage, you can offer different medical care. It could be hormone replacement therapy, it could be immune therapy where you boost the immune system, because I mentioned earlier that low immunity can predispose to it. Chemotherapy, where there are doses of drugs you give to attack the cancer cells, because cancer cells, they are greedy. Wherever they go, they want to take over. So whether good or bad, they will grab it. So when you send in those drugs in high doses, as usual, they'll hustle for it. So when they go, they grab it and it kills them before the healthy cells. But in the process, some healthy cells too may be affected, and that's where some of the complications from the medications comes in. Then the other therapies, you can do teletherapy, brachytherapy, where targeted radiations, as I mentioned, can destroy some cells, are focused on those particular portion to destroy them. And also the management of other comorbidities in the patient, because the fact the patient has cancer doesn't mean the patient cannot have other things like hypertension, diabetes, and other conditions you need to also control to improve their chances. And surgery, usually for early cases, surgery is one of the best options, where you remove the primary organ causing the issue, and you can also combine to with other things to be able to offer treatment. So informed decision making, I want to know more so I can make an informed decision. And I believe with this presentation, we'll be able to make informed decision about our own health, the health of our family, and also our loved ones. And you should do it for yourself, you should do it for your family, and do it for those around you. Thank you, Anissa. We're here to offer it all.
Thank you very much. My question is in this aspect of one, doing self-assessment. How often is a woman, or maybe the husband, is expected to carry out that assessment? Monthly. That is number one. Number two, please, I would like you to share this slide with the HR team. Okay. So my second question is in the aspect of the cervical cancer. One of the preventive measures that you mentioned is that you should reduce the rate at which you have sex.
I didn't say you should.
Okay.
I didn't say you should.
Multiple sex partners by the woman.
Okay.
to be faithful.
Outside with this your condition, question, I remember I did mention one thing, is the same for all sexually transmitted infection. Abstinence is number one. If you cannot abstain, the ABCD, be faithful to a faithful partner, and C, the C is consistent and correct use of condom. In as much as condom in terms of human papilloma virus cannot protect it entirely, because even the secretions on the outer part of either the penis or the vagina can also expose it. It still reduces the burden, especially in also reducing the risk of acquiring other sexually transmitted infections that can also increase your susceptibility of developing the virus with the human papilloma virus. You understand?
Noted now. Number one, you talked about vaccination for children.
Yes, ma'am.
And you mentioned one thing, you said before sexual exposure.
Yes, ma'am.
Preferably. Now I want to ask, children that are exposed to sex at the early age, does it mean they can't go for
I mentioned for those ones that are already sexually exposed, you have to do the HPV DNA test first to see if they are already exposed to the
so
virus.
you've got to do that before they can take the vaccine.
Yes.
That's good. Number two, the breast gets engorged. That engorgement for days, can it cause cancer?
It won't cause cancer, but it can cause what's called like mastitis, breast abscess and all. And that's why you don't wean off a baby suddenly, which can cause engorgement. For you to wean a baby, you have to start weeks or even a month ahead by reducing the frequency of feeding. Breast milk is from signal to the brain. Once you start reducing the frequency of feeding, the brain gets the signal to also reduce the quantity of breast being produced. So if you do it gradually by weaning off, either in a full day, start giving only in the mornings or in the afternoon, evening, gradually the supply keeps dropping till at a point, even when you stop, you can now do alternate days and all till you stop gradually. You won't have, the woman won't have that engorgement in the first place, so it won't cause all that, but not really cancer. It's more of the local cause. So it's always good to wear a firm bra while exercising.
Okay, thank you.
Prescriptions. There's one prescription we write as PRN, and the meaning of PRN is as the need arises. So as much as possible,
Even though
sex.
15 times in a day.
If it has to be consensual, it has to be consensual. As the need arises.
As a power As a power
Thank you.